There is a need today to look at lung cancer in a different way as we used to do maybe a few years ago. And the new approach basically consists on understanding that this is a very common disease, but in reality is a group of different diseases with different genetic abnormalities that drive the tumor process. And for some of these genetic abnormalities, we have now very specific therapies. Therefore, the most important thing is that patients, before treatment, as part of their initial evaluation, should have tests done on their tumor to investigate whether they have some of these molecular abnormalities. So that's probably the most important thing. For the physician who sees lung cancer, and the general oncologists see a lot of those patients, they have to understand there has to be an effort made to really obtain enough tissue to test for the different abnormalities. And in particular for the two that we know we have very effective therapy, and those are the EGFR mutations and the ALK translocations. So that's point number one. Point number two is that for patients that have these abnormalities, obviously the treatment should be the specific molecular therapy. In the case of the EGFR mutations is erlotinib, and in the case of the ALK translocations is crizotinib. And then that's probably the first taking point. The second taking point is obviously that in spite of these therapies being very effective, we have to accept that they are not curative. So as we adopt this new philosophy of testing for the abnormalities, we're going to be treating more and more these patients because we identify them more and more with these molecular therapies, but as we follow them, they are all going to fail. So the important thing then, the second take-home message, I think, is that as they fail, the doctors should try to be informed of any new trials or new strategies that may be developing for these patients, which eventually will involve probably, again, a rebiopsy with analysis of molecular abnormalities of resistance, and hopefully direct them to specific clinical trials.